My HeartMath story is pretty simple. It's as simple as HeartMath itself. After I took the class, I went home and I had shared it with my husband. I shared it with my mother-in-law because I was very excited about how the tools really could work in our lives. Me and my husband, we have 6 children together, and so there's not one simple story that I can tell you about how HeartMath works because there are several where it has worked in our home. So I just shared all the tools to HeartMath with my family and just explained to them how it gave them examples of how it would help in different situations that we were dealing with at home, you know, with having 4 boys and, you know, and a daughter that's going to be 2. And so my husband, you know, I told him how to use the HeartMath tools, and then the next day when I was at work, I get this text from my husband, and he said, "I used that HeartMath thing today." He said, "And that really works." He just has a very stressed job, and he went and shared that with all the people that he works with, and he said, "Now you need to come to where we work and share HeartMath with all of us." I'm Melissa Davis, and I use HeartMath.
My story starts about 20 years ago, so, but I won't take that long, I promise. When I was about 16 years old, I had been driving for a month, had my driver's license. I was hit by a 18-wheeler head-on, and it was a very horrific accident. Made it through, had some injuries that I had to work through and everything, but as you can imagine, being a young driver and going through that type of experience, it certainly has affected my ability to be comfortable in driving throughout my life. Throughout my adult life, most of the time, I would stay around small communities or stay around Lancaster and only drive outside of the city limits if absolutely necessary. And it really limited me throughout life because I had to rely on other people in order to get very far, even if it was just driving to Columbus. And you know, I took it with an open mind and thought, oh, this will be nice, it'll help me when I'm having a stressful day or whatever, and didn't really think much of how it could help me outside of work or just on a bad day. Until about a month after I had completed the HeartMath classes, I ended up having to drive to Columbus for a seminar for work. Typically it would take a lot of worrying and a lot of anxiety and stress and everything to get me to that location in Columbus. And I was constantly worried about it and put a lot of pressure on myself. But I thought, well, this is going to be a great opportunity to see if this HeartMath stuff really works. So I decided to follow what the program says and do my breathing, and lo and behold, it was the most pleasurable drive to Columbus I had ever had in my life. I turned on my music, I was relaxed. I got there in morning traffic driving downtown Columbus with no problem. And ever since then, it may seem strange to some people, but that one experience and that good experience changed my life. I've been able to pretty much drive anywhere now, wherever I want to go. I've met some people outside of the state that I've been able to go and visit and drive on my own, and that never would have happened prior to having something that would help me just calm down and relax and let go of that anxiety that I experienced. I'm now at a stage in my life where I have a 16-year-old daughter who is preparing to take her driver's test in a couple weeks. And as you can imagine, that anxiety has started all over again with the thought of having her out on the road and the dangers involved with that. I'm certainly going to, use HeartMath myself as I ride along in the car with her, but it's also an opportunity that I can pass that along to her so that she can hopefully from the beginning of driving and throughout her life use HeartMath and the techniques to relax and enjoy and just have fun. I'm Amy Reedy and I use HeartMath.
As chief nurse of Fairfield Medical Center, I get the opportunity to use HeartMath a little differently. Not only do I use it personally and lock in every morning and get some resilience for the rest of the day, but I use it to open meetings. I use about a 90-second lock-in at the beginning of any meeting I conduct, particularly if it's going to be a meeting that is going to have some difficult problem solving or some tough conversations. And it's interesting how it always lightens the mood of the meeting and allows people to seem to be able to share differently. A couple of times I have stopped meetings that we really were just stuck on whatever issue it was we were trying to figure out. One in particular was, for those of us who work in hospitals, we deal with dialysis patients, and people who get dialysis oftentimes get antibiotics. Now, you would think that dialysis would be normally scheduled and you'd be able to figure out when to give them their antibiotics fairly easily. But in fact, oftentimes the dialysis is based on someone's lab values. And so they might get dialysis on day 1 and it might be day 3 or 4 before they need it again. So we were having trouble figuring out how to dose these patients on a regular basis, since it was never really a scheduled time that they would get their antibiotics. Anyway, we had pharmacy and nursing in the room together, and we were all just trying to figure out how to do this in an elegant fashion that would make it easy to do right for both from the pharmacy side and from the nursing side. And we struggled with this for about 40 minutes. Could not come up with anything that was a reasonable solution. So I had everybody stop, and we locked in for about 2 minutes. And at the end of that, our pharmacy manager, Randy Brown, said, "What about," and he came up with this wonderful solution. And we actually had a nurse analyst in there from our IT documentation system, our information system, and a guru at how to do that electronically. And she chimed in and with a piece of it. And the bedside nursing staff chimed in with another piece of it. And within 10 minutes, they had crafted a solution that we could probably have spent 2 or 3 hours without that lock-in, never arriving at. So that was really one of those times that I thought, we ought to use this in this organization every day for every meeting. And that's just one of the many, many stories I have as a leader that I use HeartMath to help with problem solving. My name is Cynthia Pearsall, and I use HeartMath.
My HeartMath story starts in all places, the bathtub. My son, about the age 15 to 18 months, decided that he didn't want to take a bath. He didn't want to be in the tub, he didn't want to stay in the tub, and he didn't want to get out of the tub. And it just really became this very stressful time for our whole family. My husband and I would try to, you want to give him a bath, I'll give him a bath, you give him a bath this time. And it just wasn't an enjoyable time. Full-time employee, I have 4 kids. It was something I wanted to have fun with and look forward to, and it really was a time that I actually dreaded. One day, giving him a bath, I was just kind of stressed out from the whole situation and just kind of yelled a little bit, and he was startled by it, and it really upset him, and that of course just upset me. And I just picked him up and I held him for a little bit, and I realized, I'm handling this all wrong. I need to use my HeartMath. And in doing that, I started volunteering, which scared my husband a little bit, but volunteering to give my son a bath. And I used HeartMath before I gave him the bath. And then when I'd get him out of the tub, I would just wrap him up in a towel, pick him up, and just hold him for a little bit. And it wasn't immediately, but every time I gave him a bath, it got a little bit easier. He didn't yell as much, he didn't yell as loud. And finally one day I was giving him a bath, I got him out of the tub, set him on a towel, and I started to wrap the towel around him like I do all the time. And before I even got the towel around, he just grabbed me and gave me a hug. And by using HeartMath, it changed this really stressful, painful time into actually something that was fun and enjoyable, and that to this day he still every once in a while he gets out of the tub will just reach up and just want me to hold him for a little bit, and it just really helped make it a special bonding time, and it totally transformed it. I'm Regina King, and I use HeartMath.
Around 2 years ago, in 2009, my husband was diagnosed with lung disease, heart disease, and a rare blood disease. And they only gave him 6 months to live. They didn't think he'd make it past December. And he did, thank God. And I took HeartMath about that time, and it helped me out so much. And last year, I had a heck of a time with bad news. My daughter was diagnosed with breast cancer. We had to go through the surgery, and I was with her. And she had 2 young children that I had to take care of. They got the breast cancer, but I had to really learn how to use HeartMath then. My daughter needed my support. I had to be strong for her, and I did a lot of HeartMath. Then just a little while later, my mom got sick this past year, and my mom was diagnosed with Alzheimer's. So I had all 3 things going on, and if it wasn't for the HeartMath, I don't think I could have got through it. Because I would sit down and take time for myself and just close my eyes and relax, and I concentrated on breathing in my heart, and it really helped me so much. And I even taught it to some other people, that was really stressed out. But it really comes in handy. I suggest that everybody take it if they can. My name is Cheryl Capps, and I use HeartMath.
Our CEO and Chief Nursing Officer took HeartMath first, and I couldn't wait to take the class because you could physically see and feel the difference around them. And I had to wait quite a while because they had to go through training and then come back and train us. I think I was in the 2nd class. As the secretary for the president and the board of directors, I had a daily racing heartbeat and hyperventilated even though I have low blood pressure. And since I've taken my first HeartMath class, I haven't ever had that again. It really started to work that very day. I do my heart focus and heart breathing every morning and try to find something within the past 24 hours for my heart feeling. It helps to be reminded of all the things we have to be thankful for, especially working in a hospital where you have codes and the helicopter landing of our many blessings. So it really helps me personally to find something within the past 24 hours to be thankful for my heart feeling and to radiate appreciation. I have never used the M-Wave because remote controls give me chest pain, and even without that, I really feel that HeartMath has changed my life for the better. My name is Shelley McIntosh, and I use HeartMath.
I first discovered HeartMath when it was presented at a seminar at Nemacolin Woodlands in Pennsylvania. It's part of the Ohio Hospital Association. The first thing that impressed me about HeartMath was the idea that it could help our caregivers actually provide some stress reduction in caring for their patients simply by transmitting a more positive status for themselves. But as I listened to it, I thought, gee, this could really work for me as well, even though I'm not a caregiver. So we practiced a little bit of HeartMath there in a team setting, and I decided this was something I wanted to bring back to Fairfield Medical Center. So I did, and I had several people listen to the presentation, and ultimately we did endorse it here at Fairfield Medical Center. I've gone on to practice the HeartMath training and technique program more than once. I use the M-Wave. One of the first things that I was attracted to was learning to practice HeartMath when that dreaded phone call comes up on my caller ID, and I like how quick the opportunity is to become focused and become neutral, as they call it, in that circumstance. But then I've also seen HeartMath brought back into our organization and used to help gain team perspective when we have a problem of that type. I've used it personally when I get stuck with how to approach a problem or how to understand the other side of a problem. I've used it in that method as well. Finally, I've used HeartMath to assist me with doing sporting type activities like golf. Getting focused over a golf shot is just one of those bonuses outside the workplace of HeartMath. We've taught my husband, and he actually was able to put in a chip shot one day and won $1,500 for it by using the quick coherence technique on the golf course. I've also used it as a deterrent for emotional eating. I have that bad habit of food solves all problems, and I've realized that the first thing I need to do is identify the problem and get it solved rather than going to the refrigerator. And I've appreciated learning to do that as well. My name is Mina Ubing. I'm President and CEO of Fairfield Medical Center, and I use HeartMath.